What is dyspraxia? Well, I've done another video on my other channel about that, and I'll leave a little card up here so you can check that out. But long story short, it's a neurological condition that affects balance, coordination, and thought process. Now, because of this, it was often believed in previous times back, and I mean, I can kind of relate there. I'm from a generation where there wasn't a lot known about neurological disorders and mental health, and it was often blamed on other things. And also, I mean, I've had the negative side as well that oh, he's just stupid and all the rest of it. But you know, people with dyspraxia are not stupid. Albert Einstein, for example, he suffered from dyspraxia, and of course, he is an incredibly intelligent man. I don't need to explain that to you. So, you know, but how it affects people with the condition, and it can manifest at any age, although it most commonly, I believe, but again, speak to a doctor. But from what I believe, it most commonly manifest in childhood, and it certainly did in my case. When I was a kid, I had difficulty with learning to walk in the first place. And when I was a baby, I used to crawl, but I mean it wasn't your normal crawl. I used to crawl sideways like a crab, which caused a lot of amusement for people in the area, you know, including my family members. And of course, because we didn't really know much about it or know what it was at the time, there wasn't a lot that was thought about it at the time. But I mean, later on, as other things started to come to light, and then the eventual diagnosis, that's when it all starts to. Oh yeah, yeah, that makes sense now. That's why I was doing that. But at the time, nothing was thought of it. Also, communication, because of because of the symptoms. Now, there can be a problem with communication, which again, autism has those symptoms as well, but you can get it in dyspraxia as well. And I mean, as a result, I had difficulty as a child with communication, and it took me a long time to learn to speak and to speak properly. I mean, I had years of speech therapy as a child, but before that, I learned to sign. So there was that. Also, with my balance, as a child, it took me a long time to learn to ride a bicycle. I mean, I can go one now, but even now, I'm still a bit, and it takes me a while to get my balance. Once I'm going, I'm fine. But of course, if I have to stop suddenly, well, I've had a few sore ones that way, I can tell you. But these are all things with that. Same with the coordination. My coordination even now is bad. So that's part of dyspraxia. But another thing with dyspraxia, and it's where the similarities with dyslexia come in again, is not just verbal communication, as I explained there, but also reading and writing and numbers can be difficult for someone with dyspraxia, and it can be difficult for them to, because like with dyslexia, the information goes in, but it gets a little bit scrambled in the brain, and then what comes out isn't necessarily what comes in, which is why if you ask someone with dyspraxia or with dyslexia to write something down, and then you look at it and you go, what? Well, I mean, we can understand it fine because we just wrote it, but everyone else reading it's like, and it's the words are muddled. Some letters might be upside down, and numbers we can do that a bit as well, which is why a lot of people with dyspraxia can struggle in their work life and particularly at school when it comes to when it comes to schooling. Although the school process doesn't really do much to help, but that's a different video. I'm doing a video on that later, so stay tuned for that one. Little plug. But there is that, and of course, that's where the extra frustration and anxiety comes in as well, because we've got difficulty with that and with the learning side of it, and then you get ridiculed by the teacher because you're not learning fast enough, and of course you get ridiculed by the other students because, oh, he can't even do that, he's stupid. You know how it is. Children are very cruel. Also, on the physical side of it, now people with dyspraxia tend to be quite, because we've got bad balance and coordination, and as a result of that, we've got quite poor peripheral vision. I mean, I wear glasses, so my peripheral vision isn't that fantastic anyway. But with dyspraxia, it affects, excuse me, but with dyspraxia, the peripheral vision is quite bad to start with. And, and because of the whole balance, coordination and processing and all the rest of it, as I said, a doctor will explain it a lot better than I will. But basically, because of that, it means that we're quite clumsy and we've got a habit of bumping into things or knocking things over. I'm forever doing that. And of course, there's the stigma and ridicule of that, especially in childhood when you're at school. Oh, he's clumsy. Oh, he don't. You know how I don't need to explain it to you. I'm pretty sure you imagine, especially if you've got dyspraxia yourself, you'll know exactly what I'm talking about. And of course, as I said, the other side with the physical things is now there's a symptom that I only learned about recently. I wasn't really aware of this. Now I have experienced this, but I didn't really think it was. I didn't really give it much thought until someone mentioned that was one of the symptoms of dyspraxia, and I kind of that explains things. And what I'm talking about is lack of muscle definition and muscle tone. Now, with dyspraxia, because of our balance and coordination, it's quite hard for us to do physical activity anyway. And as a result, we can get a bit disheartened and a bit unmotivated when it comes to physical activity, and we get into the mindset where, because it's so difficult, we don't want to do it. Or because, especially in like a gym environment and a school environment, PE class especially, I can remember that. Because it's so difficult for you, of course, you don't want, you get embarrassed and you feel that people are ridiculing you, and quite often they are, but not always. So you don't want to do it, and you don't want to be there because you don't want that embarrassment, and it gets you unmotivated. So there is that. It takes a long time for someone with dyspraxia to actually get the motivation to do exercise in the first place. But then, because of what I said earlier about the lack of muscle tone and muscle definition, it means that when we do finally get that desire to exercise, and it takes a lot of mental effort. Just to give you a bit of background, some of you watching this, you might already know this about me, but you might not. I used to wrestle, and I used to train as a wrestler, and I used to train on a daily basis for several hours at a time, like all in, circuit training, cycling, jogging, going to the training facility and doing some ring work and practicing there. Another cycle, do some weights, exercise bike, whatever. And all in, I would do about 6 hours a day, every day. You wouldn't think it to look at me. I mean, look, I'm not saying there's no muscle there. There's a little bit. But for the amount of training I did, it's really not much to show now, is it? Let's be honest. And of course, because of that, I got, apart from the ribs, I used to get the guys say, because They used to think because you're not doing, oh, you mustn't be trying hard enough, you're not making enough effort. Well, like, well, excuse me, I'm doing twice as much effort as you are. I might not have much to show for it, but I'm doing twice as much work as anybody else here. And I used to have a rant. I'm not going into a rant about that, but guys who were with me at the time will know my view on that one, and I'm not going to go. It got very frustrating, and I got very disheartened as a result of that, and I quit. And this can happen a lot with people with dyspraxia because of what I said. Because it takes a lot of it takes a lot to get that motivation in the first place, and then when you do, because one of the other symptoms is lack of muscle tone and definition, you're doing all that work, and there's very little to show for the effort. So you start to get in the mindset, well, this isn't working, and you get this, you get in the mindset, well, this isn't working. I couldn't understand it. Why is this not working? I'm doing 6 hours a day every day, and so I would get disheartened, and I got disheartened. I quit, and of course that then falls into the other mindset, because you get disheartened, you get sick, and then you get into the whole, well, you don't get sick, but you get sick and tired. That's what I meant to say. You get fed up, and you get into the mindset that it's a bad mindset to get into. You start to get, the negative thoughts start creeping in, and I can't be bothered, and you get unmotivated, and then you sit about and you eat food, and you get a great big fat belly like this, That's the reality of the situation, and it's not nice. Like I said, I did say that I would give you the positives and the negatives, so just to be aware, those are the negative sides of it. But what I will say is, if you have any of those symptoms, again, don't automatically assume that it's dyspraxia if you have any of those symptoms. So don't, oh my God, I've got dyspraxia, I better get down the doctors. Don't be that guy, because it might not be. But if you do have concerns, yeah, by all means, speak to a doctor, but don't automatically assume, because it could be any number of things. But if you see any of those symptoms in yourself, and if you having any of those symptoms, and you start to feel that way, don't feel ashamed, because it's not your fault. You've nothing to be ashamed of, and the help is there for you. Which is another reason why I said speak to a doctor or an expert. Is it curable, and is there medication for it? Because I know some of you will be asking this question, and some of you will also be asking the question, and I've been asked this before about dyspraxia, and I've even been asked this about ADHD, which I've also done a video on. I'll leave a link to that. I've also been asked, is it contagious? Which, yeah, I know some of you watching this, I know exactly what you're going to say, because I said the same. I had the same reaction. What? Because it just sounds so ridiculous. Like, but let's just presume for a moment. Let's just presume for a moment that it's not so much ignorance, which it is, but let's give them the benefit of the doubt. Let's suppose for a moment that the person asking that question is more misinformed than actual full-on ignorant. What I'll say is, no, it's not contagious. So if I sneeze on you or cough in your direction, or whatever, or if I shake your hand, you're not going to wake up in the morning, oh my God, I've got dyspraxia, oh my God, I've got ADHD, or whatever. Neurological conditions don't work that way, which is what I'm coming to next. Yes, it's a neurological condition. So is there a cure for it? No such thing. And to my knowledge, I don't think there's any medication for it as well. I mean, it would kind of be like a lot of other ones where they would give you they might give you medications like if you're feeling depressed due to everything that's going on with this. But that's not for dyspraxia. That's for the depression, to help you with the depression that you're getting as a result of it. But for dyspraxia itself, to my knowledge, it's a bit like with dyslexia. To my knowledge, there's no actual medications for them. And I could be wrong, which is why I said speak to a doctor, because they'll know that. I mean, I could be wrong, but to my knowledge, there isn't. So, in closing, let's end this on a positive message. If you're feeling a bit embarrassed, a bit ashamed, as we discussed, please do not feel embarrassed or ashamed, because you've got nothing to be embarrassed or ashamed about. It's perfectly okay to not be okay, as the TV commercial says. It's a neurological condition. It's not your fault. It's not anybody's fault. But the help is out there if you need it. What we need to start doing, and I urge you to help me with this and help me spread this message, please be kind to each other. Be nicer to each other. Treat each other with a bit of respect. And let's go back to happy times. Remember happy. Happy was great. Let's bring back happy. Let's remove the stigma. And let's all make living with mental health that little bit easier.